Hello everyone, welcome to Pediatrics and Neonatology. This video is about migraine headache in children. Now, migraine is the most frequent type of recurrent headache in children. It occurs in 11% of children aged 5 to 15 years and 28% of the adolescent. Clinically, migraine is divided into two types, migraine without aura and migraine with aura. Now, in order to diagnose migraine without aura, following criteria should be present. Number one, at least 5 attacks should be there, and these are episodic recurrent headaches. Number two, headache lasting 4 to 72 hours. It could be 1 to 2 hours to 72 hours in case of children. Third criteria, headache with at least two characteristics. A, unilateral or bilateral in children. B, pulsating or throbbing quality. C, moderate to severe pain intensity. D, aggravated by or avoidance of routine physical activity. Fourth criteria, during headache at least one of the following should be present. A, nausea or vomiting. B, photophobia and phonophobia. Also increased sensitivity to smell and touch. Fifth criteria, headache is not attributed to any other disorder. Next is migraine with aura. Following criteria should be present. 1, at least 2 attacks should be there. 2. Aura consists of at least one of the following, but no motor weakness. A, fully reversible visual symptoms such as flashes of light, bulbs, zigzag lines, starred pattern or shiny spot. B, fully reversible sensory symptoms such as feeling of crawling insects followed by numbness. And C, fully reversible dysphasic speech disturbance. This means able to understand what is asked but cannot answer back. Now, aura should last 5 or more minutes and should be less than or equal to 60 minutes. And headache should develop during aura or within 60 minutes after aura. Third criteria, at least 2 of the following: homonymous visual symptoms and or unilateral sensory symptoms. B, at least one aura symptom develop gradually over 5 or more minutes and or different aura symptoms occur in succession over 5 or more minutes. C, each symptom lasts 5 or more minutes and less than or equal to 60 minutes. Fourth criteria is headache fulfilling the criteria 2 to 4 for migraine without aura, begins during the aura or follows within 60 minutes. Fifth, headache should not be attributed to any other disorder. Now, the duration of migraine headache is 1 to 72 hours for children, but in status migrainosus it can persist beyond 72 hours. In migraine, there is no neurological deficit, but in case of migrainous infarction, there could be a neurological deficit, and this condition is called complicated migraine. Now, 90% of the children have positive family history of migraine, and usually first or second degree relative has history of recurrent headaches. Next is the triggers of migraine headache. These include skipping meals, inadequate or irregular sleep, dehydration, weather change, menstruation, and Monday morning headache. Then prodromes prior to migraine, feeling of irritability, tiredness, and food craving. Then two important conditions: hemiplegic migraine. It is a form of aura. It may be familial or sporadic. There is transient unilateral weakness which usually lasts for a few hours, but it may last for days. Next is basilar type of migraine. It is a form of aura, and there is vertigo, tinnitus, diplopia, blurred vision, scotoma, ataxia, and occipital headache. Pupils may be dilated and there may be ptosis. Now, childhood periodic syndromes, which are common precursors of migraine headache. These include cyclic vomiting, motion sickness, abdominal migraine, sleepwalking, sleep talking, and sleep terrors, and benign paroxysmal vertigo of the childhood. Now, the complications of migraine headache. These include chronic migraine, status migrainosus, persistent aura without infarction, and migrainous infarction. Next is indications of neuroimaging in a child with headache. Now, these include abnormal or focal neurological signs and symptoms, seizures, very brief aura, atypical aura such as basilar type or hemiplegic type, cluster headaches, acute sensory headache with known underlying etiology, and in children less than 6 years who can't adequately describe the headache. Brief cough headache, headache worst on first awakening or that awakens the child, and migraine headache in a child with no family history of headaches. Now I will discuss the treatment of migraine headache in children. For acute treatment of migraine, following drugs are required: non-steroidal anti-inflammatory drugs. These include ibuprofen, acetaminophen, naproxen sodium, aspirin, and ketorolac. Other treatment include elmotriptan, oral and intravenous fluid, antiemetics including prochlorperazine, metoclopramide, ondansetron, or dihydroergotamine. Now next is prevention therapy or prophylaxis of migraine headache in children. This is required when headache occurs once or more per week or is disabling, such as affecting school, home, or social activities. Give prophylaxis for 4 to 6 months, then wean over several weeks. Now, following drugs can be used for prophylaxis: flunarizine, amitriptyline, anti-epileptics, beta blockers, and antihistamine. Now, the behavior therapy for migraine headache. Now, the most important thing is the adherence to the treatment. There should be adequate fluid intake and decreased caffeine intake. Regular exercises should be done, and the child should not skip meals. Child should have healthy food and adequate sleep of about 8 to 9 hours on regular basis. Now, biofeedback assisted relaxation therapy has also an important role. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health related videos.